Ascension, far and away for me, one of the more interesting presentations. I was curious. Previous years they had the Tony and Tony show, and the two Tonys, CEO, CFO. This year you had a whole new team. They did succession planning really well. Almost the entire team came from within. So you have just operational consistency moving forward, and based on their financials and their performance, you want that. But my favorite part of the presentation was from someone who came from outside of their organization. That's Eduardo Conrado, the Chief Strategy and Innovation Officer for JP Morgan. And I'm going to I already talked to him about having him on the show. And he gave me the quote of the conference, which was, "Tech companies are figuring out healthcare faster than healthcare is figuring out tech." So that's a great quote. He went in there and actually, as the strategy officer, took over the IT organization. So IT falls under strategy, and it should. Wow, this, as he was saying, I'm like, that makes a lot of sense. It definitely shouldn't be under the CFO. I mean, if it's under the CFO, that tells me exactly how you're thinking. But if it's under the strategy officer, I'm saying, yes, that makes so much sense. I can't begin to tell you how much sense that makes. So he established new roles: product management, design, data science, software engineering, enterprise architecture. He hired new workforce. He ended up co-locating in Austin, Chicago, as well as their St. Louis location. He bifurcated the organization into run versus build, which makes sense. Gartner's been talking about this for years. Running the business of modernizing the infrastructure versus delivering new innovation and services to the market. Why are they doing this? They researched it. 68% of 18 to 24-year-olds indicate frustration with healthcare providers, lack of digital experience. And then he had a bunch of other metrics to back this up. 64% want programs to help them select the best treatment plan. 75% want online booking. 77% want to pre-register online. You get the picture. They've done their research around the consumer journey, and they're making the right investment. They're making investments. Another thing he brought up, which I thought was fascinating: hospital at home, admitting patients into their home. Think about that, admitting patients into their home. So they're setting up acute, post-acute, virtual disease management, and wraparound services for live-at-home services. Again, fascinating, low asset way of expanding in the markets that you serve. Partnering with world-class technology companies, and we know where this is going because of the big conversation around Ascension and Google and the privacy. They just looked at it. The experience for the clinicians is not that great, and hospitalists spend 30% of their time searching for information rather than caring for patients. And so you can go out onto YouTube and see the Google presentation on the health record that they've created. I got to see the Ascension presentation, which is an internal presentation that they shared at the conference. This is, to be clear, this is the Ascension Health Record presentation. Google is providing the services to help create it, but it is Ascension's data. Ascension is controlling how that data gets used. It is not being used by the search engine. It is being used on the Google Health side to help clinicians to be more effective. And here's a couple of things. So the presentation was great. Unified view of the patient's information, all the visits. It shows trends. Search will instantly return results, which you would expect with Google. Every record is searchable, including scanned documents and handwritten notes. New information is emphasized. So if there's a new visit or new information about the patient, it's emphasized, it's brought out, because you have designers designing this, right? It's designed for quick diagnostics, dynamic charting to see new relationships and trends across the data, mobile app to free the hospitalist from their desk, which is estimated to be at 50% of the time during their shift. Notification on patient status changing because they're bringing in the telemetry data as well. So the nurses can be mobile and still see the change in the patient status. And contextual searching and multi-device access, voice navigation. So also voice navigation of this record. This is far and away the most effective HIE strategy in the country. And that's what they were trying to solve first. That's what they were trying to solve. They have 110 some odd hospital locations, different EHRs across the board. They were able to bring this data together. The record I saw and how they were navigating that record, voice navigation and whatnot, if this were our national HIE strategy, it would be exceptional. Now, they would have to break it off from Google for it to be acceptable as the national HIE strategy. I get that. And Ascension and Google have some work to do on the really the privacy aspects. It just was not handled all that well, and they need to get out in front of it. They need to continue to talk to the patient community about what are the implications and how is this technology going to be used. And that wasn't it. They were also redesigning care teams. They took a specific hospital and they're redesigning care teams around the patient, and really good results around that. They're looking to scale that up across their entire health system. And I know there are other health systems. You look at Mayo's model and Cleveland's model. They've designed around care teams around the patient. But a lot of health systems don't function that way. They function in silos. And this is a really aggressive play for a traditional player. And if they're able to do that across the board and really improve their quality metrics, could be interesting.